Good afternoon, everyone, and welcome to our Ask Her webinar. I'm Sarah Weatherby, Director of Communications at Washington Area Women's Foundation, and we're excited to have you here today for what will surely be an insightful discussion on the future of early care and education in our community. At the Women's Foundation, we are driven by our mission to invest in the power of women and girls of color across the Washington, D.C. region. Through focused grant making, advocacy, and strategic partnerships, we work to create meaningful, lasting change for those whose voices and needs have historically been overlooked. Our approach is rooted in the pursuit of racial and gender equity, and we're grateful to have you here with us today as we discuss a foundational element of equity, which is early care and education. Now, today's conversation, Champion Change in Early Care and Education, will dive deep into the current challenges facing the ECE sector, explore the barriers to accessibility and growth, and uncover paths for transformative change. Our panelists are true leaders in this space, advocating for policy change, supporting children's needs, and working tirelessly to create a stronger foundation for our communities. Before we begin, a few quick housekeeping items. We do encourage you to engage with us by sharing your thoughts and comments in the chat, and please use the Q&A function to submit questions for our panelists. We'll do our best at the end to answer as many questions as we can. And lastly, if today's conversation resonates with you, we invite you to support our work by making a gift through our website at thewomensfoundation.org/askher as we continue to amplify the needs of our community. Now, I am honored to introduce our moderator for today's panel, my wonderful colleague, Aubriana Kimbrough, who leads the Early Care and Education portfolio at the Women's Foundation. Aubriana, thank you for guiding us through this important discussion, and I'll hand it over to you.
Thank you so much, Sarah, for the introduction, and thank you all for joining us today. Before we dive into this conversation, I do want to introduce our phenomenal panelists. And while I'm doing introductions, if you have worked with any of these women in any capacity, supported their work, or are familiar with their work, make sure that you give them a shout out in the chat. Let them know that you are here, that you see them, and that you're uplifting them. But as Sarah mentioned, these are some of the leading voices in the early care education in our region. So first we have Allison Gilbreath, Senior Director of Public Policy and Programs at Voices for Virginia's Children. Allison leads the organization's child welfare policy initiatives and created Voices Foster Care Policy Network, a group comprised of partners, direct service providers, families, and youth who create a unified foster care agenda each year. She also worked to create the first ever bipartisan foster care caucus with the Virginia General Assembly. Together with the network and the foster care caucus, her efforts have led to significant policy changes like the Kinship Financial Assistance Program, supporting children and families across Virginia. Welcome, Allison. Hey again. Next, we are joined by Erica Williams, Executive Director of the DC Fiscal Policy Institute. Hey, Erica. With nearly 2 decades of experience in public policy and economic justice, Erica leads DC Fiscal Policy Institute's mission to shape radically just tax budget and policy decisions in the district. Emphasis on radically just, I know that's right. Driven by her own lived experience, Erica holds a deep commitment to anti-racism, equity, and inclusion, and is committed to centering Black and Brown lived experiences in DC fiscal policy's pursuit of equity and justice for communities sidelined by racism and economic inequality. Excited to chat, Erica. And finally, we have Kimberly Perry, Miss Kim Perry, Executive Director of DC Action. As one of the nation's leading experts in child and youth public policy advocacy and civic engagement, Kim's work involves building powerful campaigns and organizations to amplify citizens' voice. This has resulted in critical policy changes, we all know, to improve the lives of nearly 30 million children, youth, and families. And under Kim's leadership, DC Action has expanded its impact and advanced policy wins like raising the early childhood educator pay and nearly doubling the resources for the district's out of school time. So, welcome, ladies. Thank you so much for being here. And before we jump into conversation, I think that it's appropriate to ground ourselves in the unique perspectives that each of you bring to the table. So, with that, my first question is, how would each of you describe the current state of early care and education in our region? And what are the most urgent issues that we're facing in the sector right now? And Kim, let's kick it off with you to start.
Thank you so much, Abriana. And just a shout out to you and Sarah and the entire team at the Washington Area Women's Foundation for having us, for hosting this webinar. And to my sisters, Allison and Erica, I'm always honored and thrilled to be alongside them doing this really important, difficult work, but I can't imagine we'd be doing anything else. Um, to answer your question, Abriana, I think some of the challenges we're dealing with in the early education space is that it's very clear, and the evidence is clear, that learning begins at birth and that young minds need and deserve to be nurtured and educated at the start. But unfortunately, the cost of programs in our region, high quality programs in our region, are often out of reach for far too many working families who really need it. And so, in order to stabilize the early education sector, we really have to take a look at what those instabilities in the system are that's causing this mismatch between the high demand for high quality early education and what families are actually able to pay for. As many of you know, the cost of childcare can often be the second highest, yet most important expense that any family incurs after paying their mortgage or their rent. And so no family should have to be making these really tough choices about where they have to or forced to put their child when they need to go to work. They should, like some families, have the luxury of choosing a high quality program that gives them the peace of mind to be able to go to work and focus on work and also know that their child is being cared for and that the education at an early age is being nurtured. Part of that instability is the workforce that we've had. Really, our entire region has experienced very high turnover prior to 2021, to be exact. And a lot of educators in the sector are leaving just because of pay, because of low wages, that they can go out to other companies, make more, and also have access to important benefits like health and dental insurance and retirement. And so we'll talk about this in just a little bit, but in 2021, the District of Columbia, through the Birth to Three for All law, started to get ahead of that and address that workforce challenge through the Birth to Three law. And so we've seen compensation increase for educators in the sector, and that has allowed um, us to keep teachers longer, which is important, and really stem that tide of high turnover that we were seeing. So that just, I think, addresses one part of the instability challenges of the sector. And then the second, which I'll talk about, is that education, early education is a public good, and we should be treating it as such. And I think we still have lawmakers in our region that will nod their head and say, childcare is good, early education is good, but they aren't putting their money where their mouth is, and they aren't funding early education like they are K-12 education. So I'll pause there because we could go on all day long, but those are a couple of the really critical pain points that we're experiencing in early education right now.
Yeah, thank you, Cam. And I like that you named lawmakers. I like that you named like systems change because The burden and the task is really on those who are creating these systems. And although we see a lot of advocacy in early care and education at the ground level, it really does require those who are in positions of power to make the changes that we, need and want to see. So Allison, just wanted to, bring it on to you. I know that you are representing kind of like the Virginia, Northern Virginia area. So how would you describe the current state of early education in our region? And what are your thoughts on the most urgent issues facing the sector right now?
Yeah, thanks, Brianna, and thanks for having this webinar. A lot of what Kim said really resonates with where I think things are. I think to add on to that, there are 13,000 children currently on wait list to get into childcare right now. I think that's one of the most urgent issues, and the reality is it will require a $180 million investment from our state legislature to eliminate that wait list. And the other reality is that the childcare sector ecosystem can't function in this either. The instability of will they have the funding that causes great stress for the folks who are running centers. And it also causes stress in the public center, that constant instability of will we have the funding? Will the waitlist continue to grow? On top of the average income, the average hourly wage is $13 an hour. That is not sustainable in the Northern Virginia region for someone working to make a livable wage. And to make it really personal, so I currently have a 6-year-old and a 3-year-old, and I've been paying childcare for the past 6 years. And I'm about to reach, my husband and I are about to reach $100,000 that we have spent in childcare expenses. And that's us having our children at what would be considered affordable childcare. We're not at the highest cost childcare centers in our community. We are at the average cost of childcare, and that isn't sustainable. Not only that, I think about the dollars that we could have invested in other areas of their lives, other areas of our families' lives. Families are making choices, really, really difficult decisions because of the lack of affordability in our sector and the lack of access to childcare. And what Kim said is so right on, that we know from research that they are our earliest learners, and building this foundation pays dividends for the rest of their life and for our community. Our community needs young children to be educated because we need them later on in life for so many different reasons.
Thank you so much, Allison. That was really powerful to hear your perspective and to also hear that, when thinking about family planning, I don't think that growing up I ever really heard, well, let's calculate the cost of early care and education. And now we're having to like make that a part of our conversation when we think about our future and, how we want to create an experience for, our children. So thank you so much. And then to close us out, Erica, how would you describe the current state of education in the region? And what do you feel like some are the most urgent issues facing the sector right now?
Yeah, I'm feeling for you, Allison, because the cost of childcare, no, it's no joke. It's no joke. And we all know, those of us who've paid for it know about that. I think, here in DC, I agree with everything that Kim said. I don't know that there's much I could add. We are, ironically, with all the need we still have here, the need for affordable care and education for our youngest kids, the need for higher pay and full compensation for the workforce, providing, incredible care and early learning opportunities for our kids. We are in some ways the envy of the nation, right? Like we have been kind of innovative and a model for what local public investment can look like. I want to say, though, that it's sort of a low bar to get to that place of being out in front because there has been such a historic undervaluing of the, of care work in our country. And it has deep roots. I just want to name the history here, deep roots in white supremacist ideology and sexism, right? From enslavement that forced Black women to care for white children to like here in DC, Black codes that dictated what kind of work Black women could do and really forced Black women into domestic service for very little compensation to more modern day forms of occupational segregation. There has been pretty severe undervaluing of care work in our economy in this country, in the district as well. And so while we know we're doing well, we know that we have that whole history to address in the choices that we make today. And so, when we're thinking about the cost it would require to fulfill the Birth to Three law, which is a commitment we made to district residents and families back in 2018. We should remember that we are repairing a long history of harm for the workers, Black and brown women that are caring predominantly here in the district that are caring for young children, for the families that are having to like fork out more than they can afford. And frankly, for our communities and our economy as a whole, because it is holding us back. I think it's urgent that we address these issues. I think it's urgent um, that we see now as the time to like repair this harm that's been done. And we know how to do it. We have the tools. We have the expertise. We have the partnership between families and providers and advocates, all in the Under 3DC coalition that Kim leads, and that you all are supporting. So I think it's just really urgent that we get this done and that we actually fulfill the promise that we made.
Thank you so much, Erica. And I really like that you called out the historical kind of like systematic barriers that are hindering, early care and education at present day. But oftentimes, while we do see and we celebrate progress, we do know that there are still structural and policy barriers that are hindering. And I think that the same way that we call out the historic barriers, we should also call out the present day barriers. So, Erica, from your perspective, what structural or policy barriers are hindering the growth and accessibility of early care and education in the district?
Yeah, I think Kim named one of the big ones, maybe the single biggest, is that we don't see early care and education as a public good like we do our K-12 schools, right? We have not put that kind of commitment on it, even though it is a need that affects so many families and communities, right? This is not something that just a small group of people need. This is something we all need to have happen. We all need our kids in safe, high quality places where they're getting the care and education they deserve. We all need a place where like parents can get up and go to work and have reliable places, have that reliable care so that they can get to their jobs and take care of their families. And frankly, our economy needs to have a lot of people plugged into the workforce, and this is the way to do it. And we know that investing in early education pays off in spades for our economy. So I think that's a big, huge structural issue. Again, harkens back to, the racism and sexism that sort of, formed this idea that, to put it really bluntly and maybe oversimply, that taking care of kids is something that Black and brown women should just do and do for little to no compensation. When in reality, this is something that we should be investing in for the whole community.
Yeah, thank you so much. And Kim, I see that you're nodding your head. So did you want to add anything to that particular question?
Erica hit the nail on the head. What I would add to that is it's all of our jobs to be making this case. The professional advocates don't need to be the only ones making it. One of my favorite moments, maybe a couple of years ago, um, Councilmember Phil Mendelson, at large, council chair, said, everywhere I go, people are talking to me about childcare. Like, make it stop. And we were like, no, that's exactly what's supposed to be happening. Every time you're out in the community doing office hours or at an event or cutting the ribbon on a new building, you should be hearing about childcare because childcare is infrastructure. Childcare is the economy. Childcare is education. It is a pathway for our young children. And so it is that important that every lawmaker should be hearing about it, no matter where they are out in the community. And so, one of our long-term goals is that we're engaging DC residents and residents all across this region, to be honest with you, saying, making the case to lawmakers across in every state legislature that this is important and it deserves public funding. And that folks will say there are so many other pressures on budgets. That's always going to be the case, but this is an important one and one that we should all be advocating for. So I just want to hear, I don't want this to be the niche issue
Mhm.
because it just isn't. Again, it's benefiting all of us.
Yeah, thank you so much. And what I'm hearing is that childcare should be integrated in all conversations across all sectors all the time. So thank you so much for driving that point. And I like that you did mention that, you're working in partnership with local officials. And Allison, I know that your work centers youth, but partnerships with officials as well. So, as an advocate for children's policies, what strategies have you found most effective for ensuring that early care and education remains a priority for state and local officials?
Yeah, that's a great question. We in Virginia have really worked in coalition and we have really called in the business community to have a strong voice at the table, at every table that they are at, and building the connection to childcare. I will say in Virginia, we've gotten a little bit lucky, not all the way, but a little bit, where we have had a couple of major industries come to Virginia and they have gone to the governor's office and said, look, we're not going to invest any more offices or buildings unless there's enough childcare to meet the needs of our workforce. Because what's happening is that businesses are seeing the loss statement. They know exactly how much money they lose when a parent or caregiver steps out of their role to stay home with the children because they either can't afford or cannot access childcare. And they have realized it is a huge loss to their business when they cannot retain talent. And often what we are seeing in today is particularly women who are leaving really well-paying jobs that are not necessarily that are jobs that require a certain level of skill that is not easily fillable for that business. And so we have asked them to engage in this conversation. We have asked them to come and do advocacy with us. They are just as knowledgeable about the funding formula needs in childcare as the advocates are. And that has certainly moved the conversation where I at least see legislators who are more attuned and interested because they're hearing it not only from us who are advocates, not to say that we aren't important because we are, but they're also hearing it from the business community. And that the business community knows that this isn't a one and done. They know that they have to stay with us in this movement for several years to come. And so they celebrated a victory with us last session, and they're going to be right back next section because they know we cannot let our foot off the gas because the issue is so important. And going back to the earlier question of like, what can we do, we really have to dig into those funding formulas. We have to ensure that there's a dedicated funding formula for early care in every state. because that's how we get to true cost. We want our funding formulas to reflect the true cost of childcare. And the true cost is not $13 an hour for the workers. It's much greater than that. And it's also reflective of we essentially don't want any household to pay more than 8% of their income to childcare. And that's one strategy to go about that.
Thank you so much, Allison. That just reminds me, I was maybe about 6 months into my role. This is my first position in philanthropy. And I said to myself, early care and education providers are business leaders. Like, why isn't this a business issue? And it's like since then, I've been seeing more communication around this being a business issue about, tapping into the business community as allies. So thank you so much for naming that. And another quick question for you, Allison. I know that Virginia has an upcoming gubernatorial election. So are there any current or past policies that have been transformative for ECE? Or could you name some high-level items that candidates should be communicating as top of their agenda?
Yes, thank you. We do have a gubernatorial race next year, and it's going to be an incredibly important one for lots of different reasons. We need for every candidate to have childcare as one of their top priorities. Number one, it's a top priority for the constituency. Voters care about what is happening in early care and education in Virginia in particular. I think the things that they need to be focused on in particular is the funding formula for that, where we're going to get those funds, those state dollars to support the system. And we continue to want to expand our mixed delivery system in Virginia. When you talk to the providers, they will tell you, if I could get more mixed delivery dollars, I could make my business work. I could make this work. I could have more classrooms, provide high quality care. And so we have a 5-year roadmap that the next governor of Virginia could follow that could be transformative for the early care and education system. It's going to take some significant investment, but there is a cost to not making that investment as well. And it's going to impact every secretary in our Commonwealth if they don't make that investment now.
Yeah, thank you so much, Allison. And I like how you named exactly what the community wants. We know it, we hear that, and we, hope to see our candidates prioritizing community needs. Kim, this brings me to our next point that I want to pivot to. I know that with Under 3DC and all of the work that you're doing with DC Action, that you really do have a pulse of what's going on at the ground level. You know what your community needs. You are in collaboration with your community. And we know that DC Action works to eliminate disparities that are impacting children and families. So with that, what are you hearing on the ground as some of the most pressing disparities that has been brought to the attention of your organization? And specifically, I think we should also take the time to name in this moment, what exactly is Under 3DC, DC Action doing, which I know you all are doing a lot, but this is the platform to name exactly what you're doing to address the needs of the community.
Thanks, Abriana, for that question. So DC Action is the district's child and youth advocacy organization, and we are pretty explicit about our goals to close racial gaps in the areas of education, health, and economic security. We don't see our work as charitable work at all. We really see it as justice work. And that we are often through policy trying to right the wrongs of history that Erica just talked about a little while ago. One of those issues we care deeply about is early education, because we know the promise it holds for ensuring our young people have a healthy and productive transition from childhood to adulthood, and that early education needs to begin right away. We have been honored to be a member of Under 3 DC, which is, I call it a statewide coalition. You can question my use of the word state, but let's be ambitious and optimistic here. The District of Columbia, one day, will find statehood. Um, but it's a statewide coalition of almost 70 organizations now and 197 individuals coming together to ensure we have the most equitable early education system for our residents, but also to be a model for the country because every state and locality is struggling with this challenge of early education. The interesting thing about the Under 3 DC coalition is that it's powerful and it has changed the game with regard to public funding for infant and toddler care. So I just want to take you back a little bit and remind folks that the District of Columbia did universal pre-K almost 15 years ago, and that was historic at the time and was ahead of the curve. And so we have pre-K 3 and 4 here. It is funded by, and it's funded by our per pupil funding formula, and it covers school-based settings as well as charter schools, and we have community-based pre-K as well. And so the piece that was really missing, if you think about a donut, pre-K filled in a lot of that, but there was a little hole in the middle that organizers and advocates of the pre-K movement tried to get done at the same time, but lawmakers just weren't there yet. And that was the infant toddler conundrum, that when you pulled pre-K out of the childcare setting, it created even more of a financial conundrum for early education programs. Because as you all know, infant toddler care is the most expensive care because the ratios are so low. So much of what the Under 3 DC Coalition is working on is full funding and full implementation of the Birth to Three for All law, which addresses infant toddler care. One of the things that gives us hope is that the Birth to Three law, when it was going through the council, had a fiscal impact statement, I think of about $400 million. We just did an assessment of our work and what we've been able to achieve in the last 5 years since Under 3 campaign launched. We've been able to advocate for new funding, more than $216 million for infant toddler care and integrated early education. And that's historic. That really has not been done in very many places, again, trying to address the infant toddler conundrum. So we feel good about that. The other thing I want to note is because this movement is working toward more public funding for infant toddler care. Revenue has to be a huge piece of that. You can't have such ambitious goals, funding goals, without raising the challenge of revenue. We are lucky that DC Fiscal Policy Institute is one of the leaders in Under 3 DC and has used its expertise and its capacity to help guide the coalition through revenue options. I'll give one example where there's been great success in 2021. DCFPI helped to lead the coalition through pressing and pushing the DC Council to raise taxes to support increased compensation for our educators. So members of the DC Council agreed that compensation needed to be increased in theory, but they hadn't quite funded it yet. And so through that tax increase in 2021, more than the early education sector came to support this initiative. It was our housing advocates, it was our health and human service advocates who all came to the table to say, this is a critical priority for us, for our city, our state as a whole, and we need to do it. And it passed. And so Under 3 was honored to work with the DC Council to establish what is now the Early Childhood Educator Pay Equity Fund. It is allowing early childhood educators to move from $30,000 a year to $65,000 and $75,000 a year based on the credentials they hold and the experience they have. So we feel really proud of that and good about that, but that never would have happened if we weren't bold enough to realize we had to address the revenue obstacles ahead of us. And there's no doubt in my mind we'll finish this job, but it too will require us thinking about equitable revenue in the overall plan.
Thank you so much, Kim. And very quickly, just wanted to add on another quick question for you. So Allison mentioned earlier that it is important for every state to have a pay formula. And then you went on to talk about how some of the work of Under 3DC and DC Action is unique to the DC area and that the work that is being done here is very transformative. So what quick advice do you have for other states who are looking to build similar partnerships or looking to establish similar like funds like the Pay Equity Fund?
Thanks for that question. It's been so great to see so many early education coalitions either begin across the country or to strengthen, like reorganize and structure themselves. You know, one of the things that feels really important is a broad base of expertise. That often what you see in coalitions across the country is all early education advocates at the table. And that's great, don't get me wrong. But to build the strong base of support that you really need, that's broad, that's diverse, that is multi-sector, requires all those folks to be at the table, even, you know, non-traditional partners or allies that you would normally put together. So not just small businesses, but also large businesses and corporations. We've been proud to have business leaders that could be in opposition with us say, we stand with you in principle, and we believe this is the right thing to do. Faith-based leaders, union leaders, parents themselves. You'd be surprised at the number of young people, meaning think about young people under the age of 18. They are often caregivers for their little brothers and sisters. And so it's a sibling issue for them. But sitting at the table and, you know, one of the things we do is constantly sit at the table and say, who's not here? What voices are missing from these conversations? And how do we appeal to them, convince them that they deserve a seat at this table and they want to be here. And the last thing I want to mention, Abriana, is the importance of educators themselves being at the table and leading these conversations. It's easy for us as paid advocates to sit and think about this all day long. We're paid to do that. Early educators know what the pain points are because they're living it every day, which means they are that much closer to the solutions. And it's our jobs to be listening to them, following their lead. And so the role of early education program directors who are, you know, operate these programs and run them every day, and the educators inside that system are really key to be a part of these coalitions across the country. And I'm shocked at the number of groups I talk to, and that's the missing piece. They don't have educators at the table. So it's all of our responsibility because it benefits all of us.
Thank you so much, Kim. Now, Ms. Erica Williams from the DC Fiscal Policy Institute. We all know that data and policy conversations really help to get a lot of advocacy work, the traction that it needs to move forward in certain communities or to certain ears. So let's dive deeper into this and talk about some data and some policy. So I read one of your articles, and just to quote, it says, despite a growing economy, DC failed to reduce poverty overall, and for children and Black residents just last year. So with this, in your opinion, what ways could the allocation of resources and funding streams be better optimized to support both ECE providers and the families within the system?
Yeah. Well, first, let me just say, I think everything you just heard from Kim is why we love working with her and DC Action so much. I mean, you can just hear the thoughtfulness that goes into building the Under 3DC Coalition, which is like one of the most effective I've ever seen operate. So I just want to say I love Kim, Kim Perry and DC Action, and working with them is such a pleasure. Yeah, we have, I think, in the district, um, a lot of good ideas and a lot of well-intentioned folks that will often say that they want to do things like reduce the make things fair and equitable. We have stated commitments to racial equity. We have a council office on racial equity, right? We have all these um, sort of different signals that people really want to address the big social, racial, economic inequities that exist here in the district. And we are a place of very extreme inequity, right? Where you have very different experiences of living here depending on your racial ethnic background, whether you were born here multi-generation from a multi-generation family, or a transplant, whether all kinds of different factors, but very different experiences. We're a place where less than 1% of households, so in the district paying taxes, so about 1,500 households hold 46% of all of the wealth in the district to the tune of $183 billion. And then you have huge levels of poverty and hardship that are borne almost entirely by Black and Brown residents, right? So we have a lot of great things we've been doing, but a lot of inequity that needs addressing, and we really got to get serious about it. Fulfilling the birth to three law and really putting our money where our mouth is, as Kim said earlier, it's $139 million a year. That seems like a big number to people. People balk at that. Oh my dollars. It would pump $1.65 billion into DC's economy from our analysis. It would do wonders for families and communities families that are struggling to afford childcare so that they can go to work. It would be a huge investment in the future of our kids who are going to get the high quality care that they deserve, right? And so what are we willing to do? Are we willing to ask the folks that hold the $183 billion in wealth to pay a little more so that we can afford to address, like I said, some of the historic harms that have left us without this public good that we desperately need? I really think we should. And I think I feel like a big barrier we're running up against. With our policymakers, that there is a desire to do the good things, but not to ask folks who have done the best in our economy, in our local economy, to pay more so that we can achieve these things, so that we can actually fulfill the promises that we've made. So what I really want to see us doing in the coming years is, not letting up our foot off the gas and continuing to push really hard on decision makers to actually put revenue on the table again. We're not going to be able to do this without it. But doing it will also benefit everybody. So, I think we are a place that it has no shortage of resources, but sometimes we have a shortage of will. And I would like to see us bring all the voices we can to the table. Like Kim said, it doesn't have to just be early education advocates. It can be everyone calling on lawmakers to do the right thing here and to get us over the finish line when it comes to, fully funding a bill a law that we passed in 2018, right? Like we passed that in 2018. If we hadn't raised the funds that Kim mentioned, we were able to raise the revenue we were able to raise in 2021, we might have seen the whole thing disappear because we hadn't funded it. It could have just gone away because of lack of funding. We were able to get the funding. We were able to raise the revenue. We were able to raise in 2021. We might have seen the whole thing disappear because we hadn't funded it. It could have just gone away because of lack of funding. We were able to get the funding. We were able to raise the revenue. We were able to raise in 2021. We might have seen the whole thing disappear because of lack of funding. We were able to get that first tranche in and make some really important investments and get to some big wins, but we're not done yet. And we need to come back and do it again. We can look at capital gains and how we tax wealth. We can look at improving upon the property tax system to get at wealth. We have a lot of folks here who earn really high incomes and can pay a little more. There's lots of ways to bring in revenue to finish the job.
Thank you so much, Erica. And what I'm also hearing is like this collaborative approach that it really does take 100% investment from all sides and really having just a radical approach to how we get at, ensuring that our early care providers are paid a fair wage and that families can afford childcare and that children have a great start to their learning. And I do know that we are at 3:45, and I have the luxury of being able to chat with you, wonderful leaders all the time, but I do want to spend some time just answering any questions that we have in the chat. So if you want to ask any questions, now is the time. And just going to scroll up for our first one. It says, the Head Start program was specifically named in Project 2025 as something that should be eliminated, which surprised a lot of people. Do you all have a theory about why this program in particular is being targeted, and what can we all do to protect this hugely important program? Thank you so much for that question, and anybody feel free to jump in.
I'm happy to start, and then Kim, if you want to take it from there. I think we got to be really clear that racism is the undertone of the majority of everything that's in Project 2025. But when it comes to, early Head Start and that program, programs that help families out of poverty are a threat to people, to certain groups. Let's just put it that way. And I think the strategy that we need to do moving forward is focus on the data, the outcomes, the bigger picture, and as far as one strategy. And then I think we just need to say it's racism. Like, we often dance around why certain policies are purported or whatever. Ultimately, it is another form of racism. It is another way to oppress a particular group, because who benefits the most from Head Start programs? Black and Brown children and their families. And what do we see over time? That those children that attended early Head Start programs have a better start in life. They do better when they get to kindergarten and so forth. So I don't know if Kim, you wanted to add to that.
First of all, amen, amen, and amen to what you just said. We've been hearing that really all of early education and childcare is at risk. What the Administration for Children and Families and HHS and Department of Education has been able to achieve and sort of advance in early education over the last, especially 4 to 5 years, is at risk of being snatched back and taken away. This is a time where all of these early education coalitions across the country working on state level policy have to have a federal voice as well, that we've got to reach every single member of Congress, regardless of party affiliation, to make the case that early education is a public good. We've just talked about this. We need to pull out the data, because we have the data, to show how it benefits the economy, both local economy and state economy, how it helps workers. So look, no matter what you care about, whether it's business, the economy, education, or other social emotional outcomes for children, we've got those talking points, we've got that framing, we've got that messaging, but the data is very clear, and so it's really on all of us to be sharing that with members of Congress so they understand what's at risk here. And I don't know that we'll win it in the next 4 years and make our case, but we can certainly do all we can to stop the degree to which they are able to gut investments for these programs that we all know work really well.
Thank you so much, Kim and Allison. And we have one other question in the chat. And it really centers on, since the pandemic, we are seeing that parents are bypassing early care and education services and moving their youth right on to kindergarten. But we're hearing from the teachers in these programs that the children just aren't ready. So the question is, how can we encourage families to utilize quality childcare when it's so costly? And Erica, I do want you to touch on this as well, because I know that utilization of childcare subsidies and utilization of childcare programs is really key to ensuring that we have continued investment in early care and education.
Yeah, I mean, I'll just jump in and say on that last point that, when we don't, when application for the child care subsidy program, whether you're a provider or a parent, is a burden or becomes sort of a barrier to entry rather than a point of access, we've created a problem for ourselves that doesn't need to exist, and that we really need to resolve. And that's definitely an issue here in the district that folks are finding, navigating the system to participating in the program to be difficult, and they need support and help to do it. And we need to think about how we streamline our processes to make it as easy as possible for folks to participate, so that we're not missing out, and leaving money on the table. And by the way, when we leave money on the table, we tend to see here in the district that the overall budget for childcare subsidy gets cut. So I think we want to make sure that utilization is where it needs to be, and that we can continue to make the case that we have the demand for more, and need to invest in it. So I would say that. And I also just think, in general, the answer to getting folks to participate is by like bringing the costs down. Families can't afford it, and so it's not a surprise that, for example, here in DC, we have such high participation in our pre-K for 3 and 4-year-olds, because man, the minute you can stop paying, you're like everything's easier, and you've got more money for other things you need to be paying for in this very expensive place we live. So I just, we have to really start thinking of this, like Kim said at the outset, as a public good, as something that everyone needs. Our kids need it, our parents need it, our communities need it, our economy needs it, and to really make the kinds of investments that sort of do that need justice.
Thank you so much, Erica. Kim or Allison, you want to add any last points to that question?
So well said by Erica, nothing more to add.
I was just going to add some additional structural things that can take place. The process to getting childcare subsidy, like you said, Erica, can be a burden, but even things within there. So one thing that we just fixed in Virginia is before you had to, if you applied for childcare subsidy, you had to first put the other parent on child support. This was a huge barrier for a variety of reasons. People didn't want to do that. It created undue chaos and unnecessary chaos in their lives, and they just felt like it wasn't worth the process. So that's one policy lever that you can pull that can make that process simpler. Another one is prioritizing a couple of populations in your childcare subsidy program. So we have in particular children who are in foster care are prioritized. They are immediately bumped to the top of the list. They already have so many changes going on in their lives. We want to make sure that those kids are in early care and education. And then there are some other groups that we have prioritized as well in Virginia. And then the last thing I would say is it's also important for the K-12 system to be engaged in early care and education policy. They are seeing what happens when we don't make the investments. And they're some of the strongest voices in our communities. Kindergarten teachers, to me, are some of the most amazing advocates. My son just finished kindergarten last year. I asked his teacher, she said, I can tell on day one who has been in an early learning environment and who is not. And what we have to ensure that the entire community understands is that kindergarten teacher can only do so much when they have a classroom where they have to meet kids at very different needs. So it impacts everyone's child in the classroom when any child in our community lacks access to early care and education.
Thank you so much, Allison. And I love that we can close out on such a personal, real note. I feel like, sometimes when we have these webinars and these conversations, we're supposed to end on like a happy, beautiful, this is the solution. But I think from this conversation, we've learned the challenges that we're facing. We've also learned some of the best practices, and we've been able to hear, real life experiences of exactly what's going on in the early care and education sector. So we are at time, but I want to thank you all so much in the audience for joining us today, for listening, and for continuing to uplift this work. Thank you so much, Allison, Erica, and Kim, for joining us today and sharing your valuable insights. I'm always so excited to be in community with you all and excited to hear about how you are leading this work. So to all of our guests, we sincerely hope that this conversation has inspired you to support and champion early care and education in your communities. And as a reminder, if you feel moved to further support the Women's Foundation, which we do prioritize early care and education here, and you'd like to make a effort to support today's conversation, you can make a donation at thewomensfoundation.org/askher to contribute directly. Your support is instrumental in driving positive change across our region. And again, thank you all so much for joining us. We hope that you have a great remainder of your week.